going to be involved in the activities which are, in terms of the Constitution, a national government responsibility.
As Mpox continues to present a significant public health challenge, the South African Medical Research Council stresses the importance of educating the public on effective prevention strategies. The council has been leading discussions with key stakeholders on necessary interventions to help curb the spread of Mpox. So what is coming out of these engagements, and how will those outcomes help curb the spread of the virus? Joining us this morning is a scientist leading the vaccine implementation and pandemic preparedness research at the South African Medical Research Council, Dr. Duduzile Ndwandwe. A very good morning to you, Doctor. Thank you so much for your time today. Perhaps let's start off with the prevalence of Mpox in the country. How much of a concern is it?
Right. So in South Africa, the Mpox is well contained. We currently have about 24 cases and 3 deaths, and those deaths have occurred as a result of from those people that are immunocompromised. So it is well contained in South Africa because what is circulating in South Africa is clade 2, which is less virulent and less it has less transmission, as opposed to what we see in DRC, where we now have an occurrence of clade 1B, which is much more severe, and it causes high rates of mortality, especially among young people. So in South Africa, the situation is slightly contained, but it doesn't mean that we need to drop our guard down, because there's also cross-border, traveling. At the moment, what we are seeing is clade 2 circulating in South Africa.
And how do we prevent an escalation from one clade to another? As you mentioned, one possible threat is cross-border traveling.
So it's increasing our surveillance system so that we can trace those cases as they come and contain the spread as we identify those cases. And the government has actually done pretty good with the cases that we have seen in South Africa, where it's well contained, and the contact tracing has been remarkable, in a sense that all those close contacts to those cases were identified. So it's all those measures that the government has put in place that has made us to be in a position where we are slightly safer than the other countries. But with respect to the other countries and the cross-border traveling, I think it's important that we need to ensure that our borders are stringent, and we are able to test even at the borders and detect cases as they come, because it is a risk, because it's happening here in the continent.
Doctor, can you talk us through the treatment protocols? Quite an impressive success rate. Out of the 24 cases that have been mentioned, only 3 of the deaths, and you mentioned that those were in individuals who were immunocompromised. Talk us through the treatment process for clade 2.
So the treatment it's really isolation at this point in time for those that are contact, because we know that the transmission happens through close contacts, and also sexual interaction. So isolation is what has been done, and also managing the symptoms and the treatment. And I recall that SAPRA has also approved a drug for treatment. Those people have actually even recovered. From the last that I seen, that those people have actually recovered. So those are the treatment protocols that are currently available. It's more isolation, and then identifying the contacts of the case that has been identified, so that we can isolate it and be sure that it doesn't spread and contain the transmission of the virus.
One of your areas of specialization, Doctor, is vaccine implementation as well as pandemic preparedness. How prepared are we as South Africa to deal with vaccine? How available are vaccines for us?
So we are fortunate, especially in the area of my work. We are part of a coalition of funders, which is called GlobiTR. And we started engaging as soon as we saw that Mpox was dominating in the DRC. And with that, we were able to gather the evidence and try to understand what is it that we need to do in order to support researchers, because some of these cases and the clades and all of that, it requires resources that needs to be put in place. So we were able to provide some research briefs to identify priority gaps that funders can be able to fund research that is directed to the need at the moment. And in terms of the vaccines, through our engagement with partners Africa CDC and WHO Afro, we know that there has been some regulatory issues in terms of getting those vaccines available. There's currently 2 vaccines available, but they were approved in the US. So those entities, Africa CDC and the WHO Afro, are working very closely with those countries to ensure that the vaccines are available. In terms of South Africa, in terms of preparedness for vaccination, I would say that we are much more prepared in terms of looking at how do we prioritize those that are needing vaccines, and there's an establishment of a committee by the National Department of Health which looks at how can we roll out these vaccines when they become available. But I presume as WHO has put together a document on preparedness, especially rolling out Mpox vaccine, is to prioritize those that are at high risk of getting Mpox.
Well, we thank you so much for that update, Dr. Duduzile Ndwandwe from the South African Medical Research Council, as we focus on Mpox, the challenges that it poses, as well as issues of vaccine security. Really doesn't seem to be a problem for South Africa as it stands, but also acknowledging the fact that just across, the border, DRC, on the continent, Mpox really being a serious challenge there. In just a moment, we'll be taking you through some of the